Are you someone struggling with weight that keeps coming back? And I'm not talking here about a few extra pounds. I am talking about significant weight that's been there for years and is starting to affect your health, your energy, and your daily life. You've tried diet after diet and nothing seems to stick. And you're starting to wonder if there is something deeper going on, or whether there are other options you haven't fully understood yet. If that is how you are feeling, there is a reason for it. Because for many people in this position, the problem is not that you're doing it wrong. The problem is that you've been given the wrong solution. I am Dr. Almerie, consultant weight loss surgeon and obesity specialist. Almost every week in my weight loss clinic, I hear the same sentences. My patients tell me, I wish I had known this years ago, because for many people in that position, diet and exercise might not work long term. That is why I created this channel, to help you understand what's really going on and give you a clear framework to understand your options, including medical treatments and even surgery. The things you've heard about but never fully understood, the things you may feel unsure to ask about, or even afraid to talk about, so you can make the right decision early, with clarity, with confidence, and change the direction of your health for good. Let's dive in. If you are someone struggling with obesity, especially more severe weight, and you go onto YouTube looking for help, looking for something that finally makes sense, something that actually works long term, what do you find? You find thousands of videos, hacks, tips, the best diet, keto diet, low sugar diet, intermittent fasting, the perfect workout. On the surface, it all looks helpful. There are genuinely caring people, some of them even doctors, all trying to help you. But here is the problem. Almost all of this advice is built around one central idea, that weight loss is all about lifestyle changes, willpower, and control. Eat better, move more, be disciplined. That sounds right. In fact, that sounds very right. But for a large group of people, the very people I see every week in my clinic, this isn't just incomplete. It can actually keep you stuck, keeping you going in circles for years, while your health slowly declines, your energy drops, and the frustration builds, because it doesn't match what's really going on in your body. I have looked at this myself. I've gone onto YouTube, searching as if I were a patient, trying to find clear explanations of what other options actually exist, beyond repeating diets that never worked in the first place. And honestly, there is very little that clearly explains what treatments are available, how will they work, where surgery fits in, who is it for, what are the risks, what are the benefits, and most importantly, how to think through these decisions without fear, confusion, or guilt. That is exactly what this channel is here to change. Because the reality is, when your weight reaches a certain point, when you are dealing with clinical obesity, this is no longer just about a few habits you need to adjust. This is no longer just about trying harder. At this point, for many people, it's no longer realistic to lose weight and keep it off with lifestyle changes alone. This is not my opinion. This is what the evidence shows. Only about 2 to 5% of people with clinical obesity will lose weight and maintain it long term with diet and lifestyle changes alone. Most people will lose some weight and then regain it again, even when they stay engaged, even when they keep trying. And this is why everything you've tried has felt so difficult. Let me explain this in a different way. Imagine someone with severe heart disease. They've already had a heart attack. The heart specialist tells them that some of their arteries are severely narrowed. Now, yes, exercise matters, stopping smoking matters, but would we ever tell them, just go fix your lifestyle and you'll be fine? Of course not, because once the arteries are that narrowed, you need medical treatment. You may need medications. You may need a stent to open the vessels. You may even need surgery. When a disease reaches that stage, lifestyle changes don't replace treatment, they support them. This is exactly how we should think about obesity. For many people, especially those who've been trying and struggling for years, this isn't just an excess weight issue. This is a chronic disease, a medical condition where biology changes, your hunger signals change, your metabolism adapts, and all of this make it incredibly difficult to treat with lifestyle changes alone. And when that weight is already affecting your health, causing problems like diabetes, high blood pressure, issues with fertility, joints pain, this isn't just a lifestyle anymore. This is a medical condition that needs medical treatment. So what happens when the only message you hear is, try harder, be more disciplined, follow this diet, do this workout? What we are actually saying is, if this isn't working, it is your fault. This creates something very dangerous: shame, frustration, and eventually people stop believing there is a solution for them, even though they are still trying hard. This changes how we should think about obesity completely. And here is the real question. Why do we accept that someone with heart disease or diabetes needs medical treatment? But when it comes to obesity, we judge people for seeking exactly the same help. Let me tell you about a typical patient I see in clinic. She is in her 50s, she sits down, and within few minutes, you can feel the weight of the journey she's been through. She tried everything, every diet you could think of, multiple times. She knows more about food than many of the people around her, but nothing has changed. Then she says something I hear far too often. I wish I had known this earlier. I wish I had spoken to someone 20, maybe 30 years ago. Because what you start to realize as she talks is that this was not a lack of effort. This wasn't a lack of motivation. This was years of being lost in information. For years, she's been listening to different voices. One telling her to cut fat, another telling her to have more fat. One blaming calories, another blaming hormones, and after a while, she stopped knowing if she could trust anyone, including, unfortunately, healthcare professionals. Lost in stigma, she felt judged by people around her, and sometimes even in medical settings. She was made to feel that this was her own fault, that she just needed more discipline, and over time, she started believing that. Lost in fear, she had heard about medications, about injections, about surgery, but only in fragments, often the worst parts, never the full picture. No one had really sat down with her and explained what these options actually are, who they are for, how they help, and yet, at the same time, she could see her health changing, her weight increasing, her mobility declining, and her quality of life slowly shrinking. So she was stuck between two fears: fear of treatment and fear of doing nothing while her health keeps getting worse. And then she says something that stays with me. I felt ashamed to even ask. Ashamed to say she was considering medical help because she thought most of the people around her would think that she is taking a shortcut, that she was cheating, that she wasn't losing weight the right way, the hard way. So she stayed silent for a year even when help existed. Now she looks back and realizes she could have spent the last 20 or 30 years of her life in better health, with more energy, with fewer complications. That is the moment you realize this isn't just one patient. This is happening to thousands of people. And once you understand this, things start to change, and you don't have to take 20 years to figure this out. And this is exactly why this channel exists. Because if you are in that position, you don't need more tips. You don't need another diet. You need a different way to understand your weight, because continuing the same way is likely to lead to the same outcome. You need a clarity about what's actually happening in your body. And more importantly, you need to understand what your real options are. Medical options, evidence-based options, options that fit your stage of the condition. So what are we going to do on this channel? We are going to break things down clearly, step by step, so you can actually make sense of your choices. We will talk about medications, how they work, who they are for, and what their real risks are. We will talk about surgery, how it works, when it becomes the right option, and what it can actually do for you on the long term. Most importantly, we will help you understand how to think about these decisions in a clear and structured way. Because the goal here is not to push you in one direction or the other. It's to help you understand your choices properly. This channel is for educational purposes. It's not here to replace personalized medical advice with your own doctor, but it will give you the clarity, a clear way of thinking, so you could ask your doctor the right questions and explore with them all the options. No shame, no guilt, because the earlier you understand this, the more of your life you will get back. So before we even talk about treatment, we need to understand what's actually happening inside our bodies, because without this, nothing else will really make sense. I have already created a series where I break this down in a simple way. The biology of obesity, how your hormones affect hunger, why your body defends its weight, and why weight regain happens after dieting. You'll find the link to that series below here. That is the best place to start. And from there, we will start to explore all the options, what treatments are available, how they work, and how to choose what's right for you. I am Dr. Almerie. Thanks for watching the video. I will see you in the next one.